I'm Christopher Mulligan, Clinical Director and founder of GroupWorks West. Today's YouTube video is a continuation on the subject of limit setting for children and teens with autistic spectrum disorder. In our last video, we talked about the reasons why limit setting is so important, and today we're going to talk about what is limit setting. How do we define limit setting? First, we want to focus on behaviors that are clearly not acceptable. So the focus of limit setting, first and foremost, is to decrease behaviors that are unacceptable, oppositional, defiant, disorganized. And we want to also set limits in such a way that we can increase desired prosocial, acceptable behaviors. Now, one of the differences in how we approach limit setting as compared and contrasted to ABA or behavior intervention is that we don't see limit setting as a matter of forced compliance. So what this really means is for limit setting to be effective, you have to avoid power struggles. Hence, if it was forced compliance, that implies that there is a power struggle. So we believe that it's possible to set effective limits without forced compliance or power struggles. And we also want limit setting to focus on the child understanding what his or her limits are. So we want some degree of self-awareness and eventually self-responsibility. Now, one of the things that comes up a lot for parents is their own ambivalence about setting limits, and I talked about this in the previous video segment. So parents need to just get comfortable saying no, and kids need to learn to accept no. No deals, no bargains, no quid pro quos, no this for that. Examples of limit setting: preventing a child from leaving a room, blocking the child's progress towards a forbidden item or object. How about saying no, that's just what we're doing right now. Again, no bargain, no negotiation, no, that's what we're doing. Refusing to respond to arguing and provoking is a good example of limit setting. Removing distractions or closing off distracting areas. This can be an incredibly important and difficult limit to set. This relates very much to self-isolation and self-isolating behaviors where you need to cut off these areas available that are in the home. Not listening or responding or screaming. Intervening with potentially dangerous or injurious behaviors. And here's one: not responding to a child's attempt to engage in off-task behavior or conversation. So kids that are just not going to go with the program and trying to pull the parent off in a different direction. Providing a timeout for ignoring limits. Not allowing a child to interrupt conversations, very important. And putting away activities that are too loud or are otherwise somehow inappropriate or intrusive into the family. So these are examples, typical examples of limit setting that we work on here at GroupWorks West. And as I said, what is unique about our approach is that limit setting is not about forced compliance. It's about setting effective and powerful limits that do not provoke protracted, difficult power struggles. And then in our next video segment, we'll get into how we do that.